September's National Suicide Prevention Awareness Month. A new survey from the CDC shows more people are experiencing symptoms of anxiety and depression as the world continues to grapple with the coronavirus pandemic.
People have now become more isolated, resulting in an increase in substance use and suicidal thoughts. Western Mass News is digging deeper into the latest statistics from the CDC with the Mental Health Association.
COVID-19 has been debilitating and in many cases deadly to hundreds of thousands of people across the globe. But its impact extends deeper than just physically.
Mental health colleagues are reporting increased levels of stress and anxiety.
Western Mass News is getting answers with Kimberley from the Mental Health Association in Springfield. She says they're seeing more people experiencing signs of depression, anxiety, substance use disorders, and suicidal thoughts here in Western Mass as people continue to practice social distancing, isolating themselves.
Locally, we are seeing a higher demand for support.
This week is Suicide Prevention Week, and ahead of September National Suicide Prevention Awareness Month, the CDC surveyed over 5,000 adults in June. Their latest statistics revealing that 40% of Americans reported experiencing mental or behavioral challenges as a result of COVID-19.
There is a real lack of the opportunity for us to engage in meaningful conversation and connection.
In the survey, 11% reported they seriously considered suicide in a 30-day period. Lee says this year, suicide awareness is that much more important amid the pandemic, which is why she is encouraging the community to talk about suicide.
We refer to it as ASR, which is ask, support, and respond.
Suicide is the 10th leading cause of death in the U.S., but Lee tells us opening up can help prevent it from happening.
Ask your loved ones how they're feeling. Ask them how they are, and really mean it, and really listen to their response. Referring them to a professional, somebody, for example, at the Mental Health Association or another outpatient behavioral health clinic where they could go and they could speak to a counselor or a therapist about how they're feeling.
And if you or someone you know is experiencing suicidal thoughts, the National Suicide Prevention Hotline number is on your screen. It's 1-800-273-8255.
According to the CDC, some warning signs of suicide include being isolated, feeling like a burden to others, increased anxiety, and increased substance abuse.